Literacy is defined as the ability to read and write. We can think of literacy as the ability a person has to understand and communicate information. In this context, we can also think of health literacy as the ability to understand and communicate health information. Health literacy is important for everyone because at some point in our lives, we all need to be able to find, read, understand, and use health information and services. Taking care of our health is part of everyday life, not just when we visit a doctor, a clinic, or a hospital, but also when we go home with a set of written instructions from our healthcare provider. This is a patient's experience struggling to understand written health instructions.
I'm sure there was like a couple things that were a little confusing that I had to then look up and make sure that I got it all right. It was like a list of, things that I should and shouldn't do and like how to take care of pretty much like the stitches and my face and like what's the follow-up.
The challenges that come with written health instructions and low health literacy can affect us all, from the elderly questioning instructions on a new medical device to the young needing to take medications after an accident.
Again, recently after my root canal, I had to take some antibiotics, and the thing that might be a little confusing, like I think it's like a dosage plus how many times a day, but then you kind of have to figure out then like, okay, do I take it every like 6 hours, or can I take it during the day every 6 hours but then like wait, like, or do I actually have to like set up my alarm in the middle of the night and take 2 pills exactly every like 6 hours? So that wasn't super clear.
Health literacy can help us prevent health problems and protect our health, as well as better manage those problems and unexpected situations that happen.